So hello everyone. Today we are going to discuss is about the Neet MDS 2021 paper. So let us discuss that. The first question is about it's the red card in the triage. It indicates the answer is a critical patient requires immediate treatment. So remember that in a medical emergency or a disaster, there is a system to decide who gets help first based upon how much they need. So this helps prioritize who needs more urgent needs of medical assistance. So based on this system, we divide different colors to indicate the level of the urgency that are red card, yellow card, green card, and the last is the black card. The first is the red card. So this means that the patient it is in critical condition. The red means the patient is in critical condition and he needs immediate attention. So it's like a signal that says and alarms us to act now. So the person needs help right away to save their life or to prevent the serious harm. So the answer would be red. Uh, so the red card it is required for the critical patient who are in critical condition and need immediate attention. The second is the yellow card. The yellow card it is for the patient who are urgent but they are stable. So they need help but they can wait a bit if someone else need help more urgently. So it's a way of saying they are not okay, but we can attend to them after the critical cases. The third is the green card. The green card, these are for the patient who are injured or ill, but they are stable. So they can wait even a longer for the treatment. So they can wait even longer for the treatment. It's like saying they are not in immediate danger. So let's focus on the critical and the urgent cases first. The last means the black card. So this is unfortunate for the patient who are not salvageable, meaning they cannot be saved. So the black card it is unfortunately for the patient who are not salvageable, meaning they cannot be saved given the available resources. So patient who cannot be saved given the limited resources available. So in simpler words, it means that due to the severity of their condition and lack of the resources, there is little or no chance of saving them. So these individuals are given the lowest priority of transportation because the focus is on helping those who have better chance of survival with the available resources. So in your case, the red card indicates critical condition where immediate intervention is needed to save a life or prevent serious harm. So it is the highest priority for medical attention. So your answer would be here would be B. So remember this table. So the most urgent and first priority is given for the red card and least priority is given for the black card. So this table, remember, it's important for your entrance exam, and you can get another questions like yellow card indicates or green card indicates or the black card indicates. Remember that for your exam point of view. Now let us move to the second question. The second question statement is all of the following are true for the EDTA except. The option A is it is used to remove the smear layer. Well, EDTA, it is indeed used to remove the smear layer. We know smear layer, it is a thin layer of debris and organic material that can form on the wall of the root canal during the treatment. So in endodontics, the term smear layer, it refers to thin layer of debris and organic material that is created on the surface of the dentine during the mechanical instrumentation of the root canal system. So the process of shaping and cleaning the root canal system, it involves the use of files and the rotary instruments. And this mechanical action could generate a layer of smear layer or the smear material on the dentinal walls. So remember, the smear layer, it consists of dentine debris, pulp tissue remnants, bacteria, and other materials created during the instrumentation process. So it is common in endodontics to use irrigation solution during the cleaning and shaping procedure. These irrigants helps in removing the smear layer, so that allows for better disinfection and facilitating the adhesion of root canal filling material. So the common irrigants we use are the EDTA and sodium hypochlorite. So option A is correct. The second option is EDTA dissolves the dentine. So this statement is correct. EDTA demineralize and soften the dentine, especially the dentine in the walls of the root canal. So it's a part of action during the root canal treatment. EDTA, we know EDTA is a chelating agent that is used in endodontics to assist in cleaning and shaping of the root canal. So it has ability to dissolve the dentine. That is the hardest layer tissue that makes up the bulk of the tooth structure. So EDTA dissolves the mineralized component of the dentine, opening up of the dentinal tubules. So that is important for removing the debris from the tubular structure of the dentine. The third option is it is used to dissolve the pulp tissue. Yes, EDTA, it is used to dissolve and emulsify the soft tissue, including the pulp tissue. So it is safe to use in a dental procedure. The option fourth, it is toxic. Well, it is essential to clarify that it is non-toxic. So remember, it is non-toxic. So your answer of choice would be D. The moving to the next question, the image that is shown in the brown. So this brown layer, it's the synovial membrane. So the brown image represents the synovial membrane in the TMJ. We know the TMJ, it has an osseous portion, such as the anterior portion of mandibular fossa, articular eminence of the temporal bone, and condylar process of the mandible. Apart from that, there is synovial membrane in the TMJ that has a lining. It has a lining and connective tissue, and it contains different types of synovial lining cells. So the first is the anterior portion of TMJ, that consists of uh, glenoid fossa. So mandible fossa, it is a depression in the temporal bone. The mandibular fossa, well, it's a depression in the temporal bone of the skull. So it forms the socket-like structure that accommodates the condyle portion of the mandible, creating the upper part of the TMJ. Other is the articular eminence of the temporal bone. The articular eminence is the raised bony ridge in the temporal bone that is located in the front of the mandibular fossa. So together with the mandibular fossa, the articular eminence, it plays an important role in guiding the jaw during various movements. The third is the condyloid process of the mandible. The condyloid process, it is a round bony projection on the mandible that fits in the mandibular fossa and it articulates with the articular eminence. The last is the synovial membrane. This was asked in your entrance exam. The brown portion, this represents the synovial membrane. It is a thin, soft tissue lining the inner surface of the joint capsule of the TMJ. It produces synovial fluid, a lubricating fluid that helps to reduce the friction between the moving part of joint, such as condyle and the articular eminence. So this synovial fluid, what is function of that? It nourishes and provides a smooth surface for the joint movement. The champagne bottle appearance, it is indicative of, well, it is indicative of varicose veins. Varicose veins, we know they are enlarged, swollen, and twisted veins that appear dark blue or purple. The champagne bottle appearance, it is it is term used to describe the visual aspect of the lower limb in the advanced cases of the varicose veins. First of all, with the varicose veins, you will see a dilated and tortuous veins. So you will note dilated, twisted veins often visible just under the skin surface. So these veins can become more prominent over time. The second, it shows the inverted. So it show inverted champagne bottle appearance. So inverted. So as varicose veins progress, the lower limb may take on characteristic shape resembling the inverted uh, champagne bottle. So that is due to the contraction of skin and subcutaneous tissue around the ankle with the prominent edematous calf. So people with varicose veins may experience symptoms such as dragging pain, night time cramps, especially late at night. Patient also complained of mm, swelling, itching, thickening of the skin, eczema on the feet and legs, and pain during walking. So positive tests for varicose veins may include finding like you will see like dilated and tortuous veins, superficial thrombophlebitis, blowouts. The champagne bottle sign, it is one of the visual signs indicating the advanced stage of the varicose veins. Moving to the next question, the treatment for ANAG is, well, the treatment for ANAG we know it stands for the acute necrotizing ulcerative gingivitis, that is also known as a trench mouth, right? It is a severe form of gingivitis that is characterized by, you will see, painful ulcerations, necrotic lesions affecting the gums. So individual with ANAG often experience intense pain. So the pain may be spontaneous or triggered by factor like eating, touching the affected area. So you will see ulceration lesions. They are the hallmark. The patient may develop sores and ulcers that are often covered by grayish pseudomembrane. So the affected gums, as you can see here, they are more prone to bleeding. When you probe them, you will see bleeding on probing, especially during activities uh, or during activities like during brushing or eating. So apart from that, the patient may complain of foul, a taste, or the bad breath. So a grayish white pseudomembrane may be formed over the ulcerated area. So this membrane, it is combination of dead tissues, bacteria, and the inflammatory debris. Now the question here is treatment drug for ANAG is, the answer is metronidazole. Well, the treatment for the NUG, it involves a combination of strategies to address both the acute phase and prevent the reoccurrence phase. So first, the key component is debridement. So, well, it's an important step in the acute phase that involves the removal of the necrotic, that is the dead tissue from the affected area. That helps to clean and helps in the healing process. The second, antibiotics. What is the role of these antibiotics? They play a significant role in treating the anag patient, especially during the acute phase. So the most drug that is recommended for the for the anag is the metronidazole. So once the acute phase is addressed, the focus is on oral hygiene. So that includes practice like regular and thorough brushing, flossing, and maintaining the overall health to prevent the reoccurrence of this anag. So remember, the metronidazole stands out an effective antibiotic choice. It is particularly adopted at combating the anaerobic infection. So remember, you can get more MCQs from the ANAG in the this coming NEET exam. So that is important. Metronidazole, we discussed that it is antibiotic that is commonly used to treat the infection, particularly those caused by the anaerobic bacteria. Now, what is the dosage? The dosage is 400 milligram. That is given twice a day. So the recommended course, it is for the duration of the 5 days. So that means the patient will take metronidazole for total of 5 consecutive days. The metronidazole, it is effective against the anaerobic bacteria. The P gingivalis, it produces all except the answer would be leukotoxin. So remember, uh, P. gingivalis produces additional virulence factors such as collagenase, keratinase, um, such as one was collagenase, right? Other is keratinase, other is phospholipase and phosphatase and fibrinolysin. The leukotoxin, remember the leukotoxin, it is produced by another bacterium, that is that is that is by actinomycetans acticomitans and not by the P. gingivalis. The leukotoxin, it exhibits cytotoxic specificity and it destroys the human polymorpho uh, leukocytes as well as the macrophages. So other part that you have to remember for your entrance exam is that azithromycin. Remember what is the drug of choice for P. gingivalis? It's the azithromycin. It is the antibiotic of choice for P. gingivalis. Other information that you can remember is the red complex. The P. gingivalis, it's a part of a red complex that includes the Treponema denticola and Treponema forsythia bacteria. Apart from that, other factors that you need to remember is growth factors from Cytochrome ochracia and protoheme from Campylobacter rectus. It contributes to increasing the growth of P. gingivalis. That is important for your entrance exam point of view. Other you can remember is the BANA test. It is used to detect the BANA test. It is used to detect the trypsin-like enzyme in Treponema denticola, P. gingivalis, etc. Moving to the next question, identify the type of burr that is used. So this burr is the smart burr. It is also known as smart burr, or it is also known as polymer burr. So smart burr, polymer burr uh, is the answer. So the polymer burr is also known as smart prep instrument. It is a rotary instrument that is made up of specially designed uh, polymer material. So its unique design, it allows for the selective removal of the decayed dentin. So it is used to remove the decayed dentin without cutting into the healthy dentin. So that is its uh, importance. So this smart prep burr, remember, number one, self it has a self healing property. So that means it will not cut healthy dentin until a large amount of force it is applied. So second important is it will not cut the dentin unless the large amount of force you apply. So that is why it is smart prep burr. It is made up of third important is it is made up of which material? Polymer. That is both safe and effective in removing the dent and in removing the decayed dentin without adversely affecting the healthy dentin. So the smart prep burr, it may be advantages in term of minimally invasive dentistry, preserving the healthy tooth structure and providing a more controlled approach to the uh, decay removal. Next question: the common substance in sealants, resins, and bonding agent is the answer is bis-GMA. So bis-GMA, we know it stands for bisphenol A glycidyl with acrylate. So it is a resin that serve as a common substance in the dental materials such as sealant, resins, and bonding agents. So it is commonly used in dental composite material, dental sealants, and the dental cements. So it is utilized in the dental composite material, sealants, and cements. Typically, it undergo the light curing in dental applications and form a bond with enamel through the micromechanical retentions. This GM8 is a component in the formulation of dental sealants. Sealants, we know they are the thin coating that is applied to the molars and premolars to prevent the development of cavities by protecting the pit and fissure from the bacterial infiltration. So second, resins. BCMA, it is a principal monomer in many dental resin materials. It is the dental resins, also known as composite resins or the tooth colored filling. Third, BCMA, it is commonly found in the dental bonding agents. They are used to create a strong and durable bond between the dental restoration and the nature and the natural tooth structure. A injury occurred during the appendix surgery of women and there is loss of sensation from groin and anterior part of the perineum. Which of following get injured? So during surgery, if there is damage or injury to the ilioinguinal nerve, it can result in loss of sensation in the mentioned area. The ilio, the ilio, this inguinal nerves, it runs through the inguinal canal and emerges through the superficial inguinal ring to innervate the specific region. Similarly, iliohypogastric nerve, it is also in the vicinity, but it is in the near vicinity. So answer is both of them. Which of following drug it is not used in acute asthma? Well, let us discuss all these one by one. The first is hydrocortisone, right? Hydrocortisone, we know it's a corticosteroid and it is commonly used in management of acute asthma exacerbation cases. So acute asthma exacerbation, it refers to sudden and severe worsening of when there is severe worsening of the asthma symptoms. So asthma, it's a chronic respiratory condition where you will see inflammation of airway that leads to symptoms like wheezing, shortness of breath, uh, chest tightness, and coughing. So during the exacerbation, these symptoms become more pronounced and can escalate rapidly. So remember this hydrocortisone, it has anti-inflammatory properties that helps to reduce the inflammation, airway inflammation, and reduce the airway inflammation, and helps in the, it is a crucial aspect of the asthma exacerbation. The second is the 4-aminophylline. So aminophylline, we know it's a bronchodilator. Now, while it has a bronchodilator effect, it is it is not the first line treatment for acute asthma. However, it may be considered in certain cases, uh, or it can be reserved for situations when other bronchodilators such as short-acting beta agonists like salbutamol, they are not sufficient. The third is the sodium chromogylate. So remember, it has no role in treatment of uh, severe acute asthma. It is known for its mast cell stabilizing property. So, and it is more commonly used for preventive or maintenance treatment for asthma rather than the acute exacerbation. The fourth is the salbutamol. It's a short-acting beta agonist, and it is one of the mainstay in the treatment of acute asthma. It acts as a bronchodilator, providing rapid relief of the bronchoconstriction, and it is administered. It is given through the inhalation route. Identify the image. So this image was asked in your entrance exam. This one is the falciform ligament. So these ligaments it attached the liver to the front body wall and separates the liver into the left and the right lobe. Other ligaments, they are the coronary ligament of liver. So this ligament, it is part of the that peritoneal reflection that holds the liver to the inferior surface of the diaphragm. The coronary ligament extends from the diaphragm to the liver and helps to secure the liver in position. The third ligament teres. This one is the ligament teres. So this ligament, it is, remember for your exam point of view, this ligament is known as a remnant of umbilical vein. Remember that for your examination point of view. It exists in free edge of the falciform ligament and divides the left part of liver into medial and lateral section. Other is the left triangular ligament. So it is a fold connecting the posterior part of the upper surface of the left lobe of the liver to the diaphragm. So its anterior layer, it is continuous with the left layer of the falciform ligament. So your answer would be this one is the falciform ligament. Next question, the Australian uh, lady who wants to join IDA, it's known as affiliated. So these affiliated members, this category, it is for, remember, this category is for non-residing, non-resident dental surgeons that resides outside India. So to become an affiliated membrane, a non-resident dental surgeon must provide professional credentials endorsed by the dental body of that country. Other is the honorary member. Honorary member, it is for the dental surgeon of high scientific or literary standing who have rendered valuable services to the IDA. So honorary members, they are nominated by a central council. The annual members, they are the this category is for the dental surgeons who pay the annual subscription fees to maintain their membership. In a diabetic patient, the patient with the urine presents a fruity breath. Your diagnosis would be the fruity or acetone breath odor in diabetes mellitus, especially during the diabetes ketoacidosis. It is due to presence of acetone. So, in the context of diabetic patient with a fruity breath, the likely diagnosis is the elevation of acetone, and correct answer is acetone breath. Remember, these are the key points that you have to remember for your exam point of view. The acetone breath, it is seen in the diabetic mellitus patient. Musty breath, it is seen in herpetic coma patient. Uremic breath, it is seen in renal diseases. And alcohol breath, it is seen in the patient, those who are alcoholic. The next question, the treatment option in uncomplicated chloroquine resistance P. falciparum in pregnancy lady with malaria drug that is given along with quinine. The answer is clindamycin. The quinine, we know it's an anti-malarial drug that is effective against the Plasmodium falciparum. Option B, clindamycin, it is antibiotic that is often used in combination with quinine to treat the uncomplicated malaria during pregnancy. So this combination is considered safe and effective, particularly in the first trimester. So your answer would be clindamycin here. The next question, which light is used during bleaching? Which color with frequency? The answer is cold blue light with wavelength of 465 nanometer. So during dental bleaching, LED lamps, they are commonly used to activate the hydrogen peroxide gels. So these LED lamps emit cold blue light with specific wavelength of around 465 nanometer. So this type of light, it is effective in activating the bleaching agent and accelerating the bleaching process. So therefore the correct option is A, cold blue light with wavelength of 465 nanometer.